Okay, good morning. How are all of you doing? If I stumble a little or if I get grouchy, it's because I haven't had my coffee this morning. So I was on call last night and they called me at 7 this morning saying that somebody was complete and ready. And so I was running a little bit behind and didn't have time to get my coffee. So forgive me if I snooze a little bit. How are you all doing this morning? Fantastic. So I'm going to talk to you this morning about understanding your sexual health. And for us as women, I feel like this is a very underserved area of medicine. You know, there's Viagra for the guys, there are all sorts of things for the guys, toys and devices and creams and gels and medicines, but I think they forgot about us. There has been a little tiny bit of research about Viagra for women, and I don't want to have you think that this is simply a discussion about sexual health. We'll talk about some other things, but I just wanted to kind of tell you that there is hope. So there's been a little bit of research into Viagra for women, not a lot of promising things, but there is some money being devoted in the scientific community to addressing female health in that area. So one thing that I'd like to share with you is that I have noticed, and I don't know if you have noticed, a positive change. You see commercials on TV about Bristol, which is an antidepressant, but it's specifically designed to address menopausal changes in women. Osphena. How many of you have seen the commercial for Osphena? I mean, 10 or 15 years ago, you didn't see Bristol and Osphena on the television. And I'll tell you why that is happening. In case you didn't notice, 76 million of us in this country are baby boomers, okay? And that's of the 314 million total Americans, 76 million of us are baby boomers. And just to give you an idea of what that number means, in 2012, baby boomers made up about 12 to 14% of the U.S. population. And if you fast forward to 2029, that number is going to be 20%. Okay? So that's why you're seeing more attention being paid to the needs of that maturing population. Oops. Let's see. Oh, I guess I can use the clicker to. Let's see. So why do we as women go through menopause? I wanted to share with you all, I've heard some really funny things from my patients, and so I want to share a few of those funny things with you. It's definitive proof that God is a man. It's an evil plot to ruin the one time in your life when you don't have to worry about pregnancy. And everything else is going south, so why not my hormone levels? So I'd like to start at the beginning and give you just a brief overview, Anatomy 101, of what we girls look like on the inside. Oops. There we go. Let's see. Okay. So basically, we have a central core uterus, and the uterus has some attachments to it, okay? And those attachments include the cervix, okay? And the cervix is that organ that dilates open for us to have babies, and it's also where your pap smears are collected. So cervical cancer is probably the most common female cancer, which is why we get pap smears on somewhat of an annual basis, but that's a topic for another day. And then on the sides of the uterus, you have your fallopian tubes. And the fallopian tubes are where all the magic happens. That's where we conceive. So that's where the egg and the sperm unite in order for you to get pregnant. And then at the ends of the ovary, at the ends of the fallopian tubes, are these tiny little organs. They're probably only about the size of a small grape. They're the ovaries. And the ovaries are really the most important determinant in terms of your function through puberty and menopause. And then, of course, the vagina, the fun part. So literally, why do we as women go through menopause? Well, if we start at the very beginning, when we are born, we inherit about 1 to 2 million eggs or follicles at the time of birth. And then by the time you go through puberty, that number is about 300,000 to 500,000. By the time you hit 38-ish, that number is about 25,000. And by the time you go through menopause, the average age in the United States is 51. You have roughly about 1,000 eggs left, okay? Most of your eggs actually die. They undergo what's called programmed cell death through a process called atresia, okay? So if you do the math and you think, okay, the average female undergoes about 40 years of menstruating, and that's what, about 12 periods per year. That's only about 480 eggs. And if you do the math, you go from 1 million down to 500,000 and then 1,000. So that does not equate to 480 eggs. So the vast majority of those eggs just basically die. And as we mature, those eggs mature with us. So when you're 25, your eggs are 25 years old. When you're 35, they're 35 years old, and so forth. And so as those eggs mature, they lose quality and they actually die even more quickly, okay? Your ovaries actually produce your hormones, okay? And so, believe it or not, we actually do have testosterone, thankfully, not as much as they do, but we do have a little bit of testosterone. Some women have more than others, but our main hormones are estrogen and progesterone. And when you go through puberty and you get these spikes in estrogen and progesterone, that's when you get the development of your breasts, that's when you get that development of that womanly figure, the tapering in of the waist, and also sexual qualities like hair underneath the arms, hair in the pubic region. And menopause occurs basically when your ovaries stop producing as much hormone, okay? So another word for menopause is actually ovarian failure. So if all of these changes are taking place in the ovaries, and we saw before that the ovaries are connected to the uterus and the fallopian tubes, and all of that plumbing exists down at the bottom of the belly, then why do we suffer with hot flashes and memory loss and sleep disturbance? What do the ovaries have to do with all of those other things? Well, estrogen has receptors all over your body. And basically, if you think about it, your receptors are like a little glass, and your ovaries the punch. And so when that punch hits that glass, then the different organs around your body can suffer the benefits or side effects of that hormonal interaction. So the receptors in your brain, whenever you have a decline in estrogen, you can suffer from memory loss, you can suffer from problems with concentration, also problems with decreases in sex drive, and with sleep disturbances. In the breasts, you can suffer with a lack of breast development, so the breast can undergo a little bit of atrophy, or a lot as the case may be. Bone. So we as women start to lose bone at around 28 years old, believe it or not. And so I tell all of my patients, you really should be, if you're not taking in adequate amounts of calcium and vitamin D through your diet, you really need to be on some sort of multivitamin to plug those holes. But that process of bone loss actually significantly increases once we start to hit those menopausal and perimenopausal years. And then blood vessels. Believe it or not, your blood vessels have estrogen receptors. And so that's where the hot flashes come from. The hot flashes are your body's way of saying, okay, where is my estrogen? Believe it or not, an increase in heart disease as well. Skin. That's why menopausal women complain about dryness. Many of you may have seen or heard of that Oprah show where they had a guest that came on that was putting Premarin vaginal cream on her face in order to keep her skin nice and plump and keep her skin hydrated. Vagina, obviously, more dryness. which can lead to painful sex and also, believe it or not, more infections. So the vagina has her own little environment going on. There's a balance in there, and when that balance is offset either through pregnancy or hormones, that can actually lead to an imbalance and subsequently more infections. Fatty structure changes. So remember I said when you go through puberty, you start to have this spike in estrogen and you start to look less like your boy counterparts and more like, you know, your mom and older women, and that's because of estrogen. And so when you lose that estrogen, we don't significantly change our testosterone levels after menopause. And so when you lose that predominance of that estrogen, you can definitely start to get fatty deposition in places where you don't really necessarily want them, especially in the midsection. So we know what happens. How do we help ourselves to make these changes? I'm a big believer in overall health and nutrition. It's been a lifelong journey for me. I have some pretty bad obesity on one side of my family and a lot of diabetes and hypertension on both sides. And so I've always kind of been interested in keeping myself healthy. I've seen people in my family with amputations and doing insulin, and I vowed as a young kid, I am not doing that. And so one of the things that I impress upon my patients is overall health and nutrition. That's the main thing. You're going to hear more in healthcare in the coming years about prevention. Thank God we finally got it right. It's not about treating disease once you already have it. It's about staying healthy and prevention. Okay? So, adequate sleep. We've all said it. I can make it on 3 or 4 hours of sleep. I can make it on 7 hours of sleep. I'm not like everybody else. I don't need 8 to 10 hours. Wrong. You need 8 to 10 hours. Get your 8 to 10 hours. Protect your sleep. As children, we have a set bedtime. We have a set routine, mom and dad. You know, you have bath time, Bible, prayers, reading a book, and then you get in that mood for sleep, okay? Just like you get in the mood for sex, you have to get in the mood for sleep, okay? Have a set bedtime. Whether it's 9 o'clock or 9:30 or 10, turn the TV off. You can catch Jay Leno another time. Turn the lamp off. Turn all the bright lights off. Make your room nice and cozy and conducive to good sleep, okay? Try not to drink a lot of fluids so that you don't have to get up and bump your toes in the middle of the night on the way to the restroom, but get your sleep. The average adult requires 8 to 10 hours of sleep per night. Sleep is very important. It's important in terms of your emotions, and I know that very well. I am not nice to be around the day after call, so I'm going to try not to be mean to you all. But definitely, sleep is also important in terms of immunity. So when you're sleeping, your immune system, your infection-fighting system has a chance to regenerate itself. And so people that don't get adequate amounts of sleep can definitely suffer from more colds and side effects from a low immunity. Salt moderation, this is a big one, especially where the food is so very good. So there are some alternatives. So you don't necessarily have to, grab the salt out of the store. I personally buy sea salt. You can get it at Bed Bath & Beyond. I've seen it in Target lately, but it usually has like a pinkish tint to it, or if you get something fancy offline, oftentimes it'll look gray. And it actually has a lower sodium content than the average table salt. Also of substitutes like Mrs. Dash, those are excellent ways. And the reason why I mention salt is because a lot of us mention, problems with maintenance of weight in the perimenopausal and menopausal years, and water retention is a big one. And just remember, wherever salt goes, water follows. How many times have you been at a crawfish boil and then you go home and you can't fit your rings or you can't get your rings off? That's because it's loaded with salt. So watch your salt, ladies. The guys used to outnumber us by leaps and bounds in terms of heart disease, but we're catching up and even in some instances surpassing them. So watch your salt. Watch your carbs. There's this thought or idea out there about healthy carbs, your pasta and potatoes and rice and bread. You know, unless you're Lance Armstrong or Tiger Woods or Larry Bird, you really don't need all those carbs. For the majority of us, we're going home, taking care of kids, being a taxi for the kids. You really don't need a lot of carbs. So educate yourself about carbohydrates. And when I say carbs, I mean your pasta, rice, potatoes, and bread. We all know about the candies and cookies and chips and that sort of thing, but learn how to manage your carbs. Only eat the brown forms. Try not to eat carbs later than about 2 o'clock in the day, earlier if you can help it. Definitely try not to eat carbs for dinner, and definitely don't eat after 8 o'clock at night, 6 if you can help it. There was a recent study that came out. They had 2 groups of women. One group didn't change anything in their diet. Cokes, candies, cookies, nothing. The other group, and in the first group, the only thing they changed was they did not eat after 6 o'clock at night. Okay? The other group was the control group. And what they found was that in the group that did not eat after 6 o'clock at night, they lost weight. Did not change what they were eating, but simply did not eat after 6 o'clock at night. So remember that one. And then nutrition. So nutrition is very important, getting a balanced diet. And then I honestly recommend all of my patients to take a multivitamin. Do something yummy. It doesn't have to be something gross, a big horse pill. I honestly give a lot of my friends, you know, the gummy bites for gifts to say, hey, take a vitamin, and if it's yummy, you're going to remember to take it. Stress moderation. And a lot of people laugh, a lot of pregnant patients, when I tell them, watch your stress. Stress is there. There's nothing we can do about it. But you can definitely control your reaction to stress. So we all know that traffic in Baton Rouge is crazy. I say if you can't beat them, join them. So if you see me on the road, just, you know, run the other way. But, you know, driving in Baton Rouge is crazy. So if you know that, you know, going to work, that commute to work in the morning or that commute home in the evening is one of your biggest stressors, do something fun. You know, load in your favorite CD, or, you know, load in books, you know, books on tape, or, you know, do something that's stress relieving. You know, stop at Starbucks or make a good cup of coffee before you leave the house. Leave an extra 15 minutes early so that you can let me and the other crazies just ride on by. Okay? But it's your reaction to stress. And so they actually did a study on this one as well. And they did this study in men. And they showed that those men, they showed that everybody has stress, but those men that reacted to stress in a different manner, that weren't looking at the clock and racing through traffic and, oh my God, I got to get there, those men actually had a lower risk of heart disease. So there's nothing we can do about stress. It's out there. You know, we're not only having to manage home life, but we're also having to manage professional lives in this day and age. But there's a lot that you can do in terms of reacting to the stressors. And activity. This is a very important one. Stay active. Park at the edge of the parking lot when you go to the grocery store. Take the stairs. Don't ever take the elevator. Go shopping with your friends. All right? Sex is actually a very good form of exercise. It gets your heart racing. You release all sorts of chemicals that help to fight depression. Sex doesn't have to occur with somebody else. That's all I'm saying about that one. Go dancing with your girlfriends. Dance like nobody's watching, okay? Get a Wii. Dance or do some activities, play tennis in your living room. But do something. Stay active. And so I'll leave you with this. The #1 killer of American women is not menopause. I'm sure there are a lot of women that have wanted to die when going through menopause, that have considered death, but menopause hasn't killed any of us, but cardiovascular disease is the #1. So take good care of yourselves, stay healthy, and that's probably the first line of therapy in terms of battling these changes that we go through with our hormones. So how do we continue? So we talked about sleep and exercise and nutrition. How do we, whenever all that other stuff doesn't work, how do we address these changes? So when you come to see me, what I'm going to talk about first is all the other things I just talked about. And then if all else fails, then we're going to talk about hormone replacement. So estrogen is the biggie. You should never, ever, 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 ever be on estrogen replacement without progesterone, unless you don't have a uterus. Let me say that again. The only women that should be on estrogen only are those women that have had a hysterectomy. Otherwise, you need a mix of estrogen and progesterone to protect yourself from uterine cancer. Okay? And then testosterone. So testosterone is very important as well. I mentioned earlier that our testosterone levels don't change appreciably after menopause, but they do drop a little bit. And so testosterone can definitely be important in terms of your sexual response and can help with that. Bioidenticals. So there are lots of physicians, lots of people in the medical community that hate on bioidenticals. I don't hate them. You know, whatever works. If it's safe, I have lots of patients that are on bioidenticals. We are fortunate to have a few good compounding pharmacies here in town. That's where you get bioidenticals. There are three things that I would like to convey to you before you consider bioidenticals. The first being that they're not FDA regulated, okay? And so the FDA makes sure that when you buy a bottle of Tylenol, that bottle number 1 has the same exact concentration of medicine as bottle number 1,000,001. As opposed to the compounded hormones, you may get a little bit of variation in the concentration of those. And so the most important thing with hormones is that you want to stay on a nice steady state. Your hormones are already bouncing up and down, so you don't need any help with, varying concentrations. They have the same risk as traditional hormone therapy. I know, there's been a lot of talk in the celebrity community with Suzanne Summers and that sort of thing about, bioidenticals being better. But if you have a cardiologist, if you have a physician that says you cannot be on hormones because of breast cancer or any other risk factors, don't go out there and think, oh, well, I can take a bioidentical and there's no risk involved, because that's simply not the case. And then cost. A lot of insurance companies do not cover bioidenticals, so a lot of patients that choose to go that route end up paying cash. One of the other problems is that some of the testing that they usually monitor your response through saliva samples, and the research has shown that that's not a reliable way to measure your response to the hormones. So our bioidentical hormones, an option for you, they are absolutely. I saw a patient on Thursday that's doing that, and she's doing great. But everything's not for everybody, so just keep those three things in mind. So what do you do whenever you've had a heart attack or a stroke, or your mom had breast cancer, and your internist is saying, you really should not be on hormones? Then that's where some other medications come in. Hormones are the most effective way to combat the hot flashes, the night sweats, all of those changes that we go through with menopause. But whenever hormones are not an option, we definitely have some other options. So beta blockers are tried and true. They are generally used to treat high blood pressure, but they can definitely help mitigate some of those hot flashes and night sweats. Tricyclic antidepressants. So Elavil is my go-to drug. 25 milligrams at bedtime. It's not great, but it can definitely give you some relief, especially if you're not a hormonal candidate. Vaginal lubricants, can definitely be useful in terms of helping with painful sex. Bisphosphonates. So your Actonels and Bonivas, and now there's a really great drug called Reclast, which is a once yearly injection for osteoporosis patients. These drugs are very important in terms of protecting our bones. Remember I said that we start at 28, but those changes really start to skyrocket in menopause. So bisphosphonates can definitely be an important tool to treat osteoporosis and osteopenia. Antidepressants. So I mentioned earlier Bristol. So Bristol actually is paroxetine or Paxil. How many people have heard of Paxil? We've all heard of Paxil. Drug companies, I don't know, love-hate relationship. Bristol is definitely more expensive than the generic Paxil. You could come in and I could write you a prescription for Paxil. They just package it and make it real pretty, and now it's Bristol. Sleep aids. We talked a lot about sleep before, but when all else fails, sometimes we do need to do an Ambien or a Lunesta. So those are some options. All right. So when I first signed up for the talk, it was titled Perimenopause and Menopausal Changes. And then the title got changed a little bit, so I thought that I would definitely address the SEX word. So what about sex? You know, I said earlier that, you know, men have a lot of go-to things that they can depend on, but what about us? You know, there is a misconception out there that, oh, women don't care about sex, but that's not true. There are lots of studies, there are lots of, there's been a lot of information that's been collected out there that says we do care about sex. We care about good sex, and it's not just the guys. And so, not all change is good. And there are actually two major factors, and it's not that we don't want sex. The two major factors are lack of a partner, okay, and sexual dysfunction in the partner, okay? Those are actually the two major things that affect us in those perimenopausal and menopausal years. Other problems, heart disease. So high blood pressure. I talked earlier about nutrition and salt restriction. High blood pressure and the medicines used to treat it can actually really ixnay, can really bottom out your libido, so stay healthy. Diabetes. Diabetes is a horrible, awful, awful disease. Cancer, yeah, okay, there are sometimes we do things, we smoke and do things that we shouldn't be doing in order to cause cancer, but diabetes is a completely preventable disease, okay? And so take good care of yourselves, watch your carbs, eat right, exercise, but diabetes is a horrible, devastating disease, and it can definitely affect your ability to achieve orgasm, and it can definitely you know, affect you in other areas as well. Depression is another one. So you know, when I have patients that come in complaining of depression, and it's so good to have a good economy again, because when the economy went kaput, I was writing more antidepressants than I was birth control pills, and I am not a psychiatrist. So antidepressants, the vast majority of antidepressants can actually really decline, really mess up your libido. There are about a handful of them, about 3 or 4 of them, that really kind of protect you from decreases in libido, but most antidepressants can actually decrease your libido. So as your physician, I never want to fix one thing and then cause another problem. And so you have to be really careful in this particular area. And this goes back to the stress moderation. You know, we all have stress, but sometimes you just got to learn how to say no. Or sometimes you just have to turn up the radio and sing as loud as you can, and who cares about the rest, okay? So really, your reaction to the stressors are the most important thing. Neurologic disease. These are some things that are out of our control. There's a lot of research going on in these areas, but unfortunately, multiple sclerosis and Parkinson's are two devastating diseases that can affect your ability to have sex. And then body image. So, you know, I mentioned those estrogen changes and the testosterone increases, and so, you know, we as women really care about our appearance. And definitely, you know, in this particular day and age where there's Botox and all sorts of things in order to help us look younger and more vibrant, body image is an important thing in terms of sexual function. And then changing family roles. How many perimenopausal and menopausal women end up taking care of a spouse or being a roommate with a spouse? And that's not very good for your role, for your sexuality. And then there are some normal physical changes. Slower lubrication, a reduction in vaginal size. Lubricants are not going to help with that, okay? So when your estrogen levels go down, your vagina can shrink. You can lose that nice elasticity that you had. And so if you're having problems with painful sex and lubricants aren't working, you really need to consider hormones if that's an option for you. And then slower arousal. It's going to take more time for both partners to get to that point. And so just relax. Give yourself some more time. A lot of us in that particular phase in life are done with raising kids and that sort of thing. So just slow down, give yourself some time, and enjoy that process. So, conclusions. Stay healthy. If I could tell you one thing that I want you to take home from this talk today, it's to stay healthy. Take excellent care of yourselves. Your body is a temple and treat it as such. Hormones in moderation. Try everything else. There was a big study that came out about 20 years ago, the World Health Initiative. It said hormones should be given in the least effective dose for the least amount of time and then off, okay? Speak up. Your doctor cannot read your mind. And if your doctor's moving at 80 miles an hour, write here, share a little note, and leave it with the nurses and say, I know you were in a rush. I know you had to run out for a delivery. Call me. But speak up. Be an advocate for yourself. And lastly, it could be worse. You could be going through puberty. All right.